20 to 30% of people living in Ontario suffer from chronic pain. It's a complex, challenging condition to treat. At the same time, our primary care providers have very little training in chronic pain management. So ECHO came along at a time when we were facing a crisis of untreated, poorly managed chronic pain associated with excess opiate prescribing, which has led to unintentional deaths, addiction, misuse.
The idea of Project ECHO started in New Mexico by Dr. Sanjeev Arora, a hepatologist. The idea of bringing together these specialists and primary care using telemedicine, using case-based discussion, a short didactic, and measuring outcomes. Project ECHO facilitates access to high-quality care without moving the patient. You're moving the knowledge.
We get a chance every week to do a little bit of learning and then a lot of discussion around a real live case that keeps everybody engaged.
On average, we have every week we have about between 15 and 20 sites that connect with us and between 30 and 40 people from the community partners. In the team of experts, we have many different disciplines of medicine. We have pain medicine, physiatry, addiction medicine, neurology, and psychiatry, and family medicine.
We're reaching anybody and anywhere within the province, both rural areas, both northern parts of the province where there's even less access to specialists, plus a lot of urban centers.
I'm in Thunder Bay, Ontario, so on Lake Superior, and I am a family doc who has a focused practice in chronic pain. Ruth Dubin came and did a talk at one of the conferences I was at for pain. I heard the ECHO model, and it speaks exactly to what Northwestern Ontario needs. Every week I'm learning some tool, some bit of evidence or whatnot that I'll take back to my individual patient care. Probably more importantly, it's expanded our horizons and our network of communication across a very big area the size of France. So the ripple effect of ECHO has been substantial.
As family doctors, we encounter patients with chronic pain, and it can sometimes be challenging to treat these patients who are often suffering a great deal and who may have complex medical conditions or difficult social circumstances that can really impact how they experience pain. I found presenting a case at ECHO to be a very educational and rewarding experience and a really good investment of my time. I think my patients have greatly benefited from my participation in ECHO because rather than waiting for months to see a pain specialist, they have very quick access to a list of recommendations that's been generated by a whole interdisciplinary team of pain experts that I can then bring back to the patient and start implementing right away. I think the beauty of ECHO as well is that you can take what you've learned from that case and apply it to many other cases that you see in your practice.
These family physicians are doing a magnificent job. They're following the advice that we've given, they're communicating better with their patients. And the important thing to know is that the primary care providers are the first responders. So if the case is given, we ask the primary care provider community of practice, do you have any questions for clarification? They do the questioning. We sit and listen and try and say as little as possible.
Project ECHO is an excellent solution when you have a large geographical area and you have academic centers or specialist centers that are localized and not easily accessible to the whole population, and their patients will be receiving care similar to a patient that lives here in downtown Toronto and seeing a specialist here. Because the amount of recommendations and suggestions that we give to those cases is about the same of what my patients leave when they come to a multidisciplinary pain clinic right here downtown Toronto.
I think if you're someone who values a very comprehensive, evidence-based patient-centered and safe approach to treating patients with chronic pain, then Echo is for you.